All righty. So we are going to start here because we want to start on time because of our guests and respect her to honor her time as well. But I'm Doria Stewart from Atlanta, Georgia. I have my wonderful partner, Cindy Reed from Nashville. And we're so glad that you came to be on this Zoom tonight to hear about this technology that's changing a lot of people's lives. We created this platform, Cindy and I, to educate people on redox and then also be able to have people come on and share their testimonies on how this product is impacting their lives, not only personally, but also financially as well. And so, uh, a disclaimer here. We want to, we're going to share a video with you, kind of explain to you what this is and what we're even talking about, because some of you that maybe been invited on the Zoom this evening may not know what we're talking about. So we do want to talk about our disclaimer, and that is that this technology is not intended to treat, diagnose, or cure any medical health condition. What we are asking a lot of you, because I get easily distracted, is if you will, if you have to leave your screen, if you will turn off your video, that'll just help us and our guests to be able to stay focused as we are, talking. We would appreciate that. So, what I'd like to do now is introduce my co-partner here, Cindy Reed. So, Cindy, I'm going to have her share a little of her testimony of how, this technology is impacting her life, and then I'll share mine, and then we'll get on with our Zoom presentation.
Thank you, Doria. And I want to thank Doria because she has been the driver for getting this started. So this was her idea, and she's been a great friend and co-host, a friend that we met, I guess, about 3 years ago in Texas. So it's been across the states here from Tennessee to Georgia. But I am a nurse here in Nashville, Tennessee. I'm a hospice nurse. And when ASEA crossed my path, I was on that journey already looking for something more natural, holistic to manage challenges, health challenges. So when I was told how this works and the fact that it was non-toxic and native to your body, that was all I needed to hear. And then a little plus side, it can also be a nice little income on the side. So that was another draw point for me. I had some autoimmune challenges that I was dealing with and was on some medication. And of course, these things take time. So over months and a few years, couple years, I've been on it actually about 4 years now. And I'm no longer on medications and symptom free at the moment. So I owe all that, I feel like, to ASEA, to the redox molecules, because it's just helping your body communicate better. So with that, Doria, would you like to give your testimony?
Yes. So thank you, Cindy. So I've been a nurse for a long time. Actually, October 8th was 42 years. But I was introduced to this technology by a very dear friend who's a dentist, and he knew that I was open to other forms of, I would say, treatment modalities to healing. And so he said, Dory, this might be something that you might be interested in, not only for, promotion of health, but also for something that you might want to do after you retire from the hospital. So, I thought, well, I trust my friend Bill. I'll go ahead and take a look at it. And I'm going to tell you what really caught my attention. Two things caught my attention. Number one was the testimonies. It wasn't the science. You can get really deep into the science and the Krebs cycle and all that about what these molecules do in the body, but it was basically the testimonies that caught my attention. And I'm thinking, like, in healthcare, I've been a nurse for 42 years at the bedside, and I've never seen anything like this before. And then secondly, I listened to our Genesis story, and if none of you have heard that story, you really need to, whoever invited you on here this evening, to look at that, because what that did was brought this technology so that we can now experience it today. If our founder had decided to sell this to big pharma, then we won't even be on this Zoom. So it's just an amazing technology. But for me, I really didn't see a need for me for my health because I didn't have any health challenges. But for me, what it did is, I was with working as a nurse at the bedside, there's a lot of stress, and stress causes you not to sleep. And it also causes a lot of discomfort and a lot of your joints. And so for me, that's what it did. I'm able to sleep better. I have endurance, vitality. I'm able to, I'm 67, I'm still working. I love nursing, and I'm able to carry out the duties of what I need to do at work without feeling worn out at the end of the day. So thanks, Cindy, for letting me share. Appreciate it.
Thank you, Doria. And we just want to reiterate our disclaimer. Redox molecules do not diagnose, treat, or cure any disease. They just help the body increase that cellular communication. So, and we have an awesome guest tonight, Dr. Barbie Phillips, and she's going to be a fun guest as well as an interesting guest. I think you'll be intrigued by what she's using chiropractic care for. So we will hear her in a little bit later in the Zoom. First of all, I want to do a short video that just gives the explanation of how these molecules work. So if you will be patient with me, let me share my screen. And this is Alan Noble giving a short explanation here. This is found on Real Redox Results, actually. So if anyone wants to look it up, and you see all the categories on the left side, you can go back and search specific categories.
Hello, my name is Alan Noble and welcome to RealRedoxResults.com. On this website, you have access to lots of videos of real people sharing real results that they've experienced using ASEA's advanced redox signaling technology. You can simply browse through the videos or pick a particular subject that is important to you. However, if this is your first introduction to ASEA, then allow me to give you a brief overview so you can better understand why people are experiencing such amazing results. ASEA Redox represents a cutting-edge health and anti-aging technology, a new category in science that for 2 decades science had declared was impossible. A technology that many experts are calling the single greatest health science breakthrough of our lifetime. A great place to start is to get clear on what ASEA Redox is not. It is not a vitamin, a mineral, antioxidant, exotic juice, essential oil, or CBD oil. In fact, this technology goes beyond nutrition and ingredients, and yet can impact your health at a depth that no other supplement has ever come close to achieving. For many people, ASEA Redox is the missing link to better health and vitality. To grasp this breakthrough, you must understand that your body is the most complex communication network on Earth. Every second of every day, your cells pass tremendous amounts of important information throughout the body. Any breakdown in this communication, in this signaling, and you cannot achieve your full health potential. A simple example, your home goes on fire and you call the fire department. They have the fire truck, firefighters, fire hose, everything they need to put out the fire. However, if you don't have a good cell signal, they don't get the message and your home goes up in flames. Well, it's the same in your body. If your cells can't signal, then little else matters. ASEA Redox is the world's first redox signaling supplement that harnesses the power of the same redox signaling molecules that your body uses for this critical signaling process. This astonishing technology with 2 delivery systems, the ASEA Redox drink and the topical gel, Renew 28, has been validated by third-party independent science, and thanks to multiple patents, there is nothing else like it in the world. In a recent independent 8-week study with Torre Laboratories, a leading genetic research lab, it was found that drinking ASEA Redox could increase important gene signaling pathways by up to 31%, impacting 5 major areas of health: immune function, inflammatory response, cardiovascular and digestive health, as well as hormone balance. So at this point, let's take a listen to what health and medical professionals are saying about ASEA's redox signaling technology.
Inside every cell in your body, you're constantly producing negative and positive molecules called oxidants and reductants. And the contraction of that name is redox.
So with these molecules, we're amping up that communication. We're helping that cell signal.
Without these cell signaling molecules, we simply wouldn't do the gene replication that we need, the DNA sequencing that we need. These redox signaling molecules interact throughout the body with every cell that we know.
Every cell in our body needs these molecules for communication purposes. The more balanced they are, the more abundant they are, the healthier we are.
ASEA actually has the combination of the oxidants and the reductants that the body makes. So all we're doing with ASEA is enhancing what the body is already doing.
Having a product, a technology that's native to the body doesn't have to worry about detoxifying it because it knows exactly what to do with redox molecules. It's one of, if not the safest recommendation I ever make to a patient.
They found a way to stabilize them outside the body. You can actually put them back into bodies that are deficient in those molecules. That's a game changer.
To have something that at its molecular level is native to the body is nothing short of a breakthrough.
This is something that's foundational for health, for every cell. It affects every cell in our body. And not just the cells, but the very DNA within those cells. You know, we talk about the discovery of DNA as being a huge breakthrough, the discovery of penicillin. Yes, these were absolutely huge discoveries, but now we have something that actually goes even deeper.
Redox signaling molecules are like the DNA whisperer. They signal cells to be healthy. And because of age, because of medications, because of toxicity in the environment, you lose your ability to make the redox signaling molecules. So having them with ASEA simply replenishes what your body is doing natively when you were young. You know, I've been in the business for 40 years, and this is the first time that I've ever heard about the redox signaling molecules, which to me is a breakthrough of the 21st century, akin to the electric light bulb in the 20th century and maybe even the discovery of penicillin. Because your body is a redox signaling program, and to be able to replenish it on a day-to-day basis, internally and externally, is not just a breakthrough, it's a game changer.
So as you can hear, ASEA Redox truly is being hailed as the most significant health science breakthrough of our lifetime. And it's not just health. Casual athletes all the way to Olympic athletes are experiencing improvements in endurance, strength and recovery, beating personal bests and breaking documented world records. In a recent university study, mice drinking ASEA for only 7 days ran 29% further to exhaustion due to significant metabolic shifts as their body started to burn more fat as fuel. And I'm sure you've heard it said that seeing is believing. Well, this same technology, when applied to the skin, results in a healthy, clear complexion, tighter, younger-looking skin, while dramatically reducing wrinkles, stretch marks, cellulite, and many other signs of aging, all while using the body's natural renewal processes. I want to thank you for taking some time and watching this brief overview. I would now encourage you to explore some of the other videos featuring people that I've had the pleasure of interviewing over the last year or so. Real people sharing real redox results. This is Alan Noble thanking you for your time today, and bye for now.
Okay. Correct me if I'm wrong, Doria or Barbie. When we went to convention a couple of weeks ago, did they talk about those genetic pathways now were actually increased to 40% or 40-something%? Do y'all remember? 60%?
60%, yeah.
Wow. So we're learning more and more about this technology. That's the amazing thing. So we're still learning, and I'm sure we'll continue to learn what this can do. So that's exciting. So now I want to introduce our guest. So I'm going to Dr. Barbie Phillips. I'll read her bio real quickly, and then we'll just let her talk. Afterwards, we'll have time for questions and answers if we still have time, and everyone can unmute and ask their questions. So Dr. Barbie Phillips, she was born and raised in Oklahoma. She grew up on a family farm with a love for animals at a young age. She did her undergrad degree in psychology with a minor in biological sciences from the University of Tulsa in Oklahoma in 1992. She worked as a youth and family counselor for Creek County Youth Services in, you may have to help me with this, Barbie, Sapulpa, Oklahoma for 1 year, and then decided to further her education in the arena of chiropractic care. So she attended Parker College of Chiropractic and received her doctorate in 1999. She met her husband, Bob, while in chiropractic school, and they married in 1999 as well. She opened Family Wellness Center in Oklahoma. She opened Creation Chiropractic in Fargo, Oklahoma in 2013. and continue her education goals by attending animal chiropractic training at Parker College of Chiropractic in 2012 and achieved national certification in animal chiropractic by the American Veterinary Chiropractic Association. I didn't even know there was such a thing until I met Barbie. She moved full-time to Creation Chiropractic in 2020, where she currently serves families and animals with living a healthy lifestyle through through chiropractic wellness programs. Her hobbies include horseback riding, scuba diving, traveling, and RV, fitness, and spending time with her animals. She's a member of 1000 Hills Ranch Cowboy Church. And Barbie, that's just amazing. Like I said, I'd never heard of chiropractic care for animals until, you and just the last few years, and of course, coming into ASEA. So I'm going to let you just tell us, Barbie, what brought you to ASEA, or what was going on in your life when you found out about these molecules?
All right. Well, thank you, girls, first of all, for having me. It's an honor. And I'm excited to share some information. So hopefully it will be helpful to others. I was introduced to ASEA through a small sample tube that Kathleen Oliveri had walked up to a booth of mine. I was working in Stillwater, Oklahoma, at a dog agility show. And she was visiting her daughter there. She's from Mississippi. And so she was visiting her daughter in school and came over and introduced it to me. And, she was a really nice lady, and got to know her just a little bit, but it was very brief. I'm a very scientific person. So of course I do research on everything. And I researched for 4 months on redox molecules before I ever even took the sample tube and used it. She said it was good for wrinkles. And so I put it on my face after 4 months. It was in November of 2019. And so once I used it, the first thing I noticed was that I increased air in my lungs. And I was like, well, that's random. And so now that I understand more about the molecules, I understand the why. It's going to work on the most emergencies first. And I had years of chronic respiratory and bronchial issues as a child from the time of 9 years old all the way into adulthood. And I am happy to say that since beginning ASEA, I have not had any of those episodes. So that's a big win for me. That was not exactly what I was expecting from it. I had been praying for 2 years that, God would just show me something to help me feel better, because I had reached a point in life where I had brain fog all the time. I, was turning over 50, so everybody was thinking hormones, and so was I, but I didn't know really a way to naturally solve that problem. I also was having memory issues and low energy, sleep problems. And so I had been praying for 2 years until Kathleen, I call her my angel, walked up to my booth and delivered the goodness of ASEA to me. And after I started ASEA, the liquid, which was in March then of 2020, I began to start to see some random changes, and they, again, were not what I was hoping for. We had been having several small earthquakes in Oklahoma. They blamed it on some of the oil field things at that time. And at night, I would, for the longest time, feel my bed shake. And I noticed that over time, I was like, boy, we are having a lot of earthquakes. And I kept talking to my husband. I'm like, have you felt that? And he's like, no. And so I started paying attention to that. And I realized it wasn't earthquakes, it was my body shaking. And I was having irregular heart issues going on and didn't even know it for quite some time. The first thing I noticed when I started ASEA was within 3 weeks that stopped. And I've never had another episode. And that was probably going on, I don't even know how long, years, but I just didn't recognize what it was. And it took about 4 months and my brain fog started to lift. It was just like a light bulb kind of, turned on for me. And I felt it physically. And I began to have better memory. I began to get more energy, because at the rate I was going before, I was like, Lord, I can't serve at the level that you're asking me to, because I was going in all directions doing my office in Woodward. I was doing my office in Fargo. I was traveling on the weekends. A couple summers in a row, I traveled 13 weekends going to barrel races and also agility shows. I loved it all. But in order for me to keep serving at the capacity, I knew something had to change. So it was definitely an answer to prayer. I did notice that within several months that under my right arm, I had, with my wellness program, decided to get some IVs that were vitamins, and it caused my lymph nodes under my right arm to blow up kind of about the size of a orange. It was huge. And it took months to go down. But then as I started ASEA, the remaining parts of that, I started rubbing the gel on that. It kept that at bay, and that has continued to get improvements. So that's been a great success also. I did make fun of my mother, I'm embarrassed to say, for years for having leg cramps that made her toes stand up at night. And guess what I got blessed with several years ago? I was like, I deserve that. And it has been a wonderful, the gel, putting it on before bed to keep that at bay. And so I have been very grateful for that because I've experienced a few of those. And I also was targeting some low back discomfort. And it took, some people noticed things right away, but the low back issues that I've been really targeting, that I really wanted to see success with right away, it's taken right over 3 years. So I do encourage people to stick with it because it's going to work on the areas that it needs to first. And I know I'm repeating that, but I do need people to hear that. And that's why longevity is really important. Something that did change for me, I would rub the Renew 28 on my gut because I had digestive issues. I couldn't eat foods like trying to be a health person. I couldn't eat vegetables, especially raw ones. I couldn't eat nuts, things that I used to. My digestive system had just gotten really out of control. But when I look back about what I've learned is you take being put on antibiotics and codeine cough medicine from the time you're 9 years old for chronic coughing and sickness for years and years and years, all the way into adulthood when I started making the choices of my own to go more natural. I'm pretty sure the gut flora got really destroyed, and it took a lot of years to change that. So along with the ASEA liquid, I also started taking the Biome. This is another longevity tip. It took me 5 times to start Biome before I could successfully take it because I would get really irritable and gas in the bowels, and it just would get inflamed. And I was taking one capsule. So it took me 5 different times of backing off, starting again, backing off, starting again. And I would talk to Barbie Bassett and she'd, give me tips. And then now I take 3 a day. So I know my gut is getting much healthier, but I had to push through some of that. So I encourage people to hang in there and push through those times. I did have, back in 2020, when all the wonderful virus was going around, a lot of sick patients. I was exposed no less than probably 50 times, and I just kept plugging along. I took between 12 to 16 ounces of ASEA a day. I thought, if this stuff's going to work, it better work now. So I upped my dose. My husband got very sick, and so did my mother. She had come home to my house. I'd brought her home to recover from a back surgery, so we came home from a hospital. And she got sick first, and then my husband got sick. And I helped both of them through a very difficult time. We'll talk more about that here soon. But my hair started falling out, and I didn't get symptoms of what the normal COVID was, but my hair was coming out by chunks. But this was months later after that. It was coming out, my hair's fairly long, and it was coming out by the roots. And I thought, okay, apparently I was affected in some way, and that's how it manifested with me. And only recently, and when the radiance came out, have I started growing my hair back. I lost over 1/3 of my hair, literally. My hair used to be, it's getting thicker. And up under these areas, I lost all the hairline back here, and it's about this long now. So I'm super happy for the radiance. My nails grow, and unfortunately, so do my toenails. So I have to care for those a lot. But my hair is finally getting healthy again, and I'm excited about that because that was a really horrifying thing when you have really long hair and it's coming out by the chunkfuls. So that was a great win for me. My happy dose of ASEA, a lot of times people ask those questions, is about 8 to 10 ounces a day. And I have been up and running hard the last couple weeks, late nights. I get up every morning and work out at 5:30 in the morning. And so even if I'm up late, I push those morning workouts. And so I will tell you today, I've had about 16 ounces today. Every once in a while, I have to throw that in. So, and that helped get me through my day. But as I was preparing for this Zoom tonight, I thought, how did I get in the health that I was? Because I think of myself as pretty health conscious. I try to make good decisions. And I started thinking back to injuries that I'd had even when I was a child and what brought me to the point of health where I was having all these issues and brain fog and memory issues and the low energy. And I thought, this goes all the way back to when I was 4 years old. And so if it went back that far, just think of how long at the cellular level it's going to take a body to heal. I got my first horse and my first dog at age 4, and that's where my love for animals began. But my little Welsh pony kept running off with me, which means I fell off of him a lot of times. And one of the times that he ran off with me, I was thrown off, thankfully, into sand in a ditch, and he stepped on my head. And my dad, I can remember, he had a Jeep at the time running after the horse because we were getting close to a blacktop highway, and he cut the horse off. And he had a piece of rebar and beat my horse to death. And of course, I'm like, don't hurt the horse, don't hurt the horse. And I'm crying. And I'm like, I want to ride my horse back home. So he puts me back on the horse and off I go. And there was many of those situations where I came off a horse. I got a horse off of a racetrack that was a 2-year-old. And I should have known there was a reason why it was not successful on the racetrack. And so it ended up being a cattle horse. It was my first horse to train in high school, but a lot of injuries on horses. And I even had another one when I was about 6 months from graduating from chiropractic school. My sister and I decided that it would be a really great idea to ride this same horse doubles and let my husband at the time, which I had brought home to meet my family before we got married, ride her horse. We didn't even make it past getting in the saddle. And I got a very serious injury to my low back. It was the second injury because I had an injury in high school in basketball too that put me down pretty hard. And that's where I was introduced to chiropractic care. So that's kind of a little bit of history. I was raised on a farm, which meant I drove the tractors. I did the swathing of the hay. I lifted and carried buckets of feed to cattle and you name it. My dad had all girls, so we just worked hard. And then I look back at undergrad years, and don't judge me, but I was a bartender and I became the banquet manager at a Marriott hotel in Tulsa and worked my way through undergrad school. So I would carry 4 cases of beer on my shoulders at a time. I lifted kegs of beer, and I was very strong being a farm girl. But I thought all these things, as I was looking at this, it's no wonder my body started to break down. And and then I look at the career paths and work in simultaneous offices and traveling. And yeah. And then the stress, in 2020, when, of course, my husband got the virus and my mom did. But before that, he had also had a brain bleed. And then he also had a horse injury where he collapsed a lung, fractured 12 places in his vertebrae, and just had a terrible injury, broke the tip off his scapula. So the stress of helping my family recover from things over the years took a toll on me mentally too, which I think when you're in the midst of that, I go into action. I'm sure you girls do too in the healthcare field. And I just do what needs to be done. And it didn't hit me until probably last year how much that impacted me emotionally. And that's been an ongoing process. But I think I would have been a vet if I could have made peace with putting animals to sleep, but I knew I could never do that. And so my career path took me in different directions. And I am a product of a divorced family. And so that brought along a lot of challenges as a child too. And I believe that's what took me into the counseling road, is I wanted to help children and families. And I did love that work. I actually, to this day, miss that work of working with the kids. But what I quickly realized is it was such a broken system that you couldn't make much of a difference. And I wanted to just like steal all the kids and take them home with me. And so once again, I went to prayer and I asked the Lord to share something with me that I had more control of, because this just wasn't going to work for me for a career. And my introduction to chiropractic in high school led me back to chiropractic. And I ended up going to chiropractic school, of course. And there I was introduced to animal chiropractic on a weekend courses. And when I got out of school, I did begin human and some animal chiropractic, working under referrals from vets for over 10 years. And then when I went back to chiropractic school for animals, I was then released from that when I got my national certification. And now I do not have to have those vet referrals. So that's kind of my history of becoming health and wellness minded and chiropractic, and what brought me to the point of where I needed help. And some of the uses that I use, just personal experiences, the gel. I am sure a lot of people on the call have used this for a lot of like sunburns. You can put it on and it takes the sting away. I use that a lot with my clients as well. The gut, we do massages on the gut with our clients with the Renew 28 in a clockwise direction. So that's always important, as well as taking ASEA. And then strength training recovery, very important, because as we especially get older, we need these molecules so that our body can recover from our workouts and that we can still have muscle strength and recovery to do what we need to do. Dry eyes, I take the liquid and I would get a just a cheap empty eyedropper container at the store, clean it out really, really good, let it dry. And I put those molecules in there and use them for eye drops for myself. My patients do that. I use the spray bottles like this and put ASEA in it. And I use that to spray over my eyes. The one thing I have learned is working with animals, I get a lot of bacteria in my eyelids and in my eyelashes. And so I was getting recurrent infections in them. And I was using the ASEA drops, and everyone was talking about all the results, and I would help with my dry eyes, but not that. But then I started spraying it where it would get into my eyelids, and that has made all the difference in the world. So now I do both. And that really helps with getting that bacteria cleaned out of my eyelids. I will mention with my hair loss, my eyelashes fell out, a lot of them too. So they're just growing back now too. Ant bites, my first experience with insect bites was the Renew 28. We didn't have the clay mask at the time, but I got over 40 bites on my feet working in my garden one time. And that was just a couple summers ago. So put the Renew on there over and over, and boy, did that calm those down. But recently I've even been stung when we were out cleaning trails, getting ready for a trail ride, on the face by one of those black wasps. And oh my goodness, the stinger stuck in my face. And it was the first time that I actually carried this small little ASEA Renew 28 in my fanny pack when I was out working. And I put that on immediately, but boy, it was hurting. And so when I got home, I put the clay mask on it several times, and that really helped draw the sting out of that. And it took about a week to heal up from that. Now, my husband recently had a bee sting to the chest, which was actually at the trail ride we were just on. And I put the Renew 28 on once, and that was it for him. So it's great to work for those types of things. Gum health, that's another one. I have been an Invisalign person for a long time. It's supposed to have been 15 months, and I'm going on 3.5 years now. And so my gum health, the orthodontist always mentions how healthy my gums are. He said, especially with wearing Invisaligns and, just bacteria can build up in it. He said, I've never seen anyone with as healthy gums as what you have. And that's always a great compliment. And of course, we swish those molecules in our mouths, and that keeps our gums healthy. Sore muscles, very important to rub that Renew 28 on them, or sometimes I'll spray if I'm somewhere. And then I also have had rough spots on my face that I've actually had to have burnt off with liquid nitrogen. And I had a spot that had to be cut off my neck. And so I had some scar tissue back there. And just the use of the Renew 28 and then now adding the clay mask keeps that roughness off. But it's also, I had a crease across my nose because she burnt so deep. And when I mentioned it to her, she said, well, it's better than me having to cut your nose. And so just be grateful. So I had this crease across my nose for years. And I have noticed that that is actually going away finally. And I'm like, wow, I can't believe it. And that's been years there. So that's been a really great success. And with patients, I do have patients that have a lot of even simple things like dry hands, something I didn't necessarily think of, but I have one patient that actually orders the moisturizer and just uses it for her dry, cracked hands, and it works really great. Of course, whenever I use the skincare line, which I love, I put that moisturizer on it and then I rub the rest on my hands, and that really helps because I'm out in the elements a lot and washing my hands a lot. I have clients that have had vascular issues or do have vascular issues around the ankles. And I have recently started having them put the clay mask on. And then after leaving that on for 10 to 15 minutes and then washing it off and drying it, I have them put the Renew on. And that has been really awesome to increase circulation to those areas. So that's been a great thing. I have children and adults alike that sometimes, especially getting in the wintertime, start to have ear issues. And instead of a lot of times doing prescription medications and stuff, we try to find alternative ways. So I have actually had them use the mask behind the ear on the mastoid bone back here and on the eustachian tube. And once they leave that on for about 10 minutes, then I again have them follow up with the Renew 28, and they do a massage downward towards the throat whenever they use the Renew 28, and that will help drain what might be in those eustachian tubes and help them get that out of those areas. And then it helps with the inflammation that's in those ears as well. Mental focus and clarity, that is something that a lot of my clients struggle with, and I can definitely understand where they came from. So we use the cell performance, mind cell performance with them to help with mental focus and clarity, as well as we have regimens, of course, with the ASEA liquid, and that helps a lot. A lot of people may suffer from mood issues, anxiousness, sleep problems, and of course, we pull out the mood cell performance for them. Some people can take this at night. Doria's got hers tonight. I've already had mine this morning. The last 2 days, I've had to pull this out because I've had a lot of anxious feeling inside just because I've been so busy. And this has helped, like 2 days of this in the mornings, and I've been great. But I can't take this right before bed because I have to get up and use the bathroom all night. If I do cell performance before bed, some people can. Some people take this to sleep, and I have patience, so everybody's different. A lot of energy issues. Energy cell performance has been great. I am sensitive to caffeine with heart issues and such. So on occasion, I can do a little bit of that. But most of my patients that are not sensitive to caffeine, of course, can take the energy drink mix. And then we have clients that have thin skin or a lot of bruising. And again, we pull out the Renew 28 or those dark spots that are on the arms. And that has been amazing for the change in those skin tones. And then respiratory issues, of course, all the way back to 2020, Again, we mentioned these don't treat any issues, but I've had a lot of clients that had residual from those viruses, and we will have them use the Renew 28 on their chest, as well as the carotid arteries, so that it gets into the blood system, and then the ASEA. It has taken a good year and a half to help people rehab from some of these things. We also use cold laser in our business, and I use a lot of cold laser along with a lot of these products and helping serve my clients. They definitely, they call all the after effects have names, and we just have to rehab. So that is definitely something we're still working on along with nutrition. So that's just kind of a few things we use in the office. I would now like to do some screen share and do a little bit of fun stuff on some pictures and some testimonies. I will mention that it is not in my scope of practice to recommend ASEA products for my animal clients, but everything you're going to see on here are things that I've used with my clients, and so they have cells too, and it works, and so I will share those with you. We're going to start out. I'm going to share my screen, and we're going to talk about, first of all, my horse Calico, and my good friends the Schwinns are on here. And Lyman, if you're out there, I know you remember this. So my horse Calico, she is 21 now, but we had a situation. We had a couple of things happen with her, but we were cleaning trails, and it was very, very dry in the fall of 22, and the ground looked dry. So we walked up to the pond to get a drink of water, and the ground gave way. And she slid. I was on the ground. Thankfully, God had me get off my horse before I walked up there, and I had a hold of her reins, and she slid straight into the pond. And had I not had a hold of her face, she would have drowned. She flipped on her side and went straight down into the muck, and it sucked her down. It was like clay. And we worked and worked and worked and could not get my horse out of this pond. I did not know that I was going to be taking my horse home that day. In all my years of riding since the age of 4, and I'm 54 now, it is the scariest thing I've ever had happen in my entire riding career. Long story short, we got her out, but Lyman, this gentleman here, and I had to dig her out. We were getting in the stuff. We were getting pulled in. At one time, she was pulling. We each had halters on her, pulling, trying to get her head out. And she was about to flip over backwards, taking us in the pond with her. And we were, by the grace of God, able to get her back down. But she just could not get out of this muck. And, I got down there and I'm praying and talking to her. And I'm like, girl, you can see here, she was just absolutely worn out. The tugging on her neck took a major toll. It injured her neck with us pulling on her, try to get her out. It injured her pelvis. She had sacral issues, pelvis issues. She's still on rest now. I have ridden her on a trail ride once since then, but her stamina was not great. But what I did is brought her home, and thankfully we got to bring her home, and started giving her 20 cc's of ASEA twice a day. And what I've known, she's been a good teacher for me in several episodes that she's also had with digestive issues. The 20 cc's rectally is how I gave them to her. And I order these syringes that have a little bit longer, I don't know if I can get it in the picture. They have a longer tip on them. And so you can get this in the rectal area. And once they relax, you can slowly put these molecules into the rectal area. They absorb very quickly into the colon. And so that would help get these into her cells. So I had to do that a couple times a day. I would take the ASEA Renew, and I also would massage that in her ears and let that absorb. And so I did this for quite some time until she told me that she was through. each time she's had an episode of something, even when she's just been lethargic or something like that, she has shut me off by not allowing me to put the ASEA in the back end. And so she tells me when. She has had multiple digestive issues. She went to 4 days at a local vet, and then she also went 5 days to a specialty hospital. They couldn't get her to eat. They were tubing her, doing all these things. The specialty hospital was 3 hours away. We had to deliver her and then bring her back home after that. But they called me and they kept in touch, but they just couldn't get improvements. I am crying at home going, I have to go see my horse. I have to go see my horse. Wow, didn't know that was coming. But I thought she was going to die. And I gathered up my ASEA stuff and my cold laser, and off we went. We drove 3 hours, and they were feeding. She was in a dark area with lots of other horses, and I gave her ASEA 20 cc's 3 times during an hour. Where they had the IV, I put the Renew 28 on because it can absorb very good if the hair's shaved. She got massages, she got adjusted, she got cold lasers, she got everything. And I went home, and the next day, I think this is part of that post-traumatic stuff I still deal with. But the next day they called me and said, come get your horse. She's ready to go home. And I continued to treat her at home with the same course, and she's fantastic now. We're still recovering from these pond issues, but she's doing great. She gets to retire here on my farm. So anyway, let me pull myself together on that. All right, the next one. This is Snoopy. I inherited her. This is Bo. He was a rescue dog that we just ran over in the road one day. Great Dane came to our place. Lots of dental issues. We have learned that the stinky mouth and the buildup on the teeth, if you, what has worked for me, I will spray the ASEA in their mouth and on their teeth, and it really helps with that. Snoopy had some dental work and had some teeth pulled just last week. So I sprayed on her gum line and rubbed the Renew 28. And I will mention that at this point, you know, ASEA is not approved for animal use. They will not say it's for animals. So I just want to put that out there. But I have definitely used it on eye issues as well with my dog. I will spray it in their face from a distance and let that mist go on them. I just had to do that last night because when she came back from dental work, she had a little bit of an eye irritation. Ear issues, stinky ears, I will put it on a cotton swab and I will put it inside their ears, the liquid, and clean them, and then I'll put the Renew on the inside, and that has worked really great. This is a current injury that I'm working on a horse of mine that cut her back of her bulb of her hoof, and we didn't know it had a piece hanging in my horseshoe, or found it, and we had to cut this off like not very long ago. When it cut off, it just started spewing blood. So my assistant was out there with us. I said, run, go get the Renew. So she got the gel and we put it on. Of course, it helps with the stop of the bleeding. We put some pressure. And this was kind of starting, I think this was the second day when I took the picture. And this was a few days after. Yesterday, I took a new picture and it's about as big as this part right here. And it's only been a couple weeks. So that's been pretty phenomenal. Again, I definitely want people to know I use my cold laser with these kind of injuries too. I use Renew as along with it. This is my current ASEA Redox kitty. He decided to come home on my husband's truck one day. And this was, let's see here. I'm trying to think how long ago that was. He was maybe 3 or 4 weeks old. And I think he's probably about 3 months old now. But he was one sick kitty. You can see in his eyes, he had eye issues. He had diarrhea. He was lethargic. He was skinny. And the first thing I did was start giving him Redox by mouth and spraying it on his bottom because he was protruding, because he had had so much loose stools that he was so inflamed. And so just every time I'd go by him, I'd just spray him and give him a little redox. Usually I would give him in just a little syringe. I'd give him like, 2 or 3 cc's whenever I did that initially. This to this was 1 week, guys. This looks like a completely different kitty. So he got the name Redox. He's my mascot now. And this was just the other day. This is his picture, and he's thriving well. I intended to find a home for him, and he found a home with us. So this I will share as my mom recently, it's been 2.5 weeks ago. She was getting her hot tea out of the microwave, tripped and dumped it in her groin, her arm, and the side of her leg, and had severe burns, severe burns. She has been on Redox for quite some time now, and she knew instantly to start spraying that. I was so proud of her. She sprayed because, of course, touching it was awful. You can see where this blistered up right here, but it never broke open or anything. It healed from the inside out and just dried up all along this area. Her arm had a really severe deep burn. She ended up getting cellulitis in this arm. I will mention that, and did have to get some antibiotics for that. But this is like 2.5 weeks. So this is a really great testimony. Once again, I did use my cold laser with this. So, but she applied. We would clean it. We'd put Renew 28 on it once she could do that. And she sprayed and she sprayed and she sprayed, and we kept it covered. And we did this every day, every single day. My friend, Linda, and she's on tonight, I believe. This was a testimony you can see in April of 23, 4/4/23. She started putting the molecules, the gel on, and started drinking the Redox molecules. Just slightly after that, this was 4/26 when she had surgery over this fracture of the scaphoid bone. This is 5/25. You can hardly even see the fracture line, guys. And this was Redox that she did. You can see here, she sent me this. Full motion, it may take 6 to 12 months after the first surgery to recover. This was like 6 weeks. And you can see how good that fracture was. She was gracious enough to send these pictures, and that is just such a great testimony. And she got released early to go back riding her horse. We horseback ride together. This was another personal episode. I was reaching under a couch to get the rescue kitty because he ran away from me. And when I got up, I got bit by something. I have no idea what it was, but this was large. It did nothing for a couple days, and then it went massive, the whole inside of my thigh. This little dot never hurt. This never hurt until day 3. Of course, I put Renew on it. When it started hurting, I started putting the mask on it. This went down to this size within about 3 days of that. And it took about a full 2 weeks for all of this to go away. But let me tell you, the sting in this, I don't know if it was a scorpion, a spider, what, I have no idea. But then it all went away. And that was just Renew 28 and the clay mask. This one, and I hope I don't start crying on this one. This is my husband. This is just a minor picture of him in 2020 when he caught the virus. We took him to a local hospital after 3 days of his oxygen levels being in the 80s. He was stubborn, wouldn't go anywhere. We'd been in and out of the doctor's office. He was misdiagnosed with bronchial problems. So by the time we got to the doctor, it had been 12 days. Well, as nurses, guess what the criteria was for getting infusions, right? 10 days. So they refused to treat him. He was sent home basically to die. So I had a friend who was an RN at another hospital. And I texted her in there and said, hey, this is where we're at. She said, let me go talk to the ER doctor. And they said, load him up. So we went from one ER to the other ER. We spent 9 hours that day in the ER. They threw the kitchen sink at him. And I'm so grateful they gave him the infusion, even though it was 12 days. He got medications, he got inhalers, he got oxygen. They set him up with home oxygen. He was on it for over 2 months. We used ASEA Redox as he was able to inhale the mist. He was able to take it orally when I could get it down him. We rubbed the Renew on his chest. And guys, I was off work for a week, and we did not sleep for a week because he was out of his head. He could not make heads or tails. He'd wear his oxygen on his head. I'd have to put it back in his nose. He couldn't breathe. He was delirious. My friend and myself knew that I needed to take him home if I was going to do natural stuff with him. And I brought him home rather than put him in the hospital. Every hour we were doing inhaling mist. We were taking some Redox. We were rubbing the Renew. I was lasering him. I was giving everything. We were trying to get medications down him. We were doing everything possible. And we were up an entire week before he had a turning point. After coming off of the horse injury and thinking my husband was going to die, after coming off the brain bleed and watching a horrifying experience with that and thinking my husband was going to die, and here watching my husband die. This was tough. And anyway, these are more recent pictures showing that he made it. And this was this summer jet skiing. In December, we had pulmonologist. He was 100% ground glass appearance in both lungs. As you girls know, is not good. He has 0 lung damage, 0. And we have been scuba diving for 20 some years. He was forbidden to dive again. But his last appointment with the cardiologist was, if you still look as good as you do when you come back in December, which is 2 months from now, then you will get released for diving again. And he said he would never dive again. So guys, I had no idea this was going to happen today, so I'm sorry. I didn't have stories for the first few years on Redox. But I got the stories now, and it's real. I'm thankful to Bertus and for Tyler for sharing this technology that not only has changed our life, but it's hard when you can't get people to listen. His sister recently passed away a year ago. But I also believe that people, their time is predetermined, and it's okay when people have their own journey, that we have to let them have their own journeys. But I also feel like we have to fight for those who don't know and who don't understand that there's hope. And the only thing I can say is, if you're on the fence about this, just say yes. Let your journey begin, because why wait when there's hope and you have the potential to heal from the inside out by getting molecules into your body that are needed to help your genetic pathways, help you heal at the cellular level. And it's okay to do your research. I did 4 months of research, but take my research and let it work for you and just get started. Because there is no doubt that this stuff works. And now I have stories, and I will continue to share them with people. Thank you, girls. That's all I got.
You definitely have stories, Barbie. That's amazing. I mean, I had no idea you had all those stories, to be honest. Wow. And I think you covered a lot of my questions just with what I was listening to and watching. Whew, that is tough. So, obviously it works very well with humans. When you started with animals, did you get a lot of pushback when you suggested that to anybody that was having issues, or even with your patients, any pushback? Or do they trust you because you're a doctor?
I would say about 80-20 to begin with. 80% would not listen. 20% did, had good success. Now it's probably about 50-50, honestly, after about 3 years. We send information to them just like we do people so they can understand it, and then ask them that if they have questions to talk to their vet, or we're happy to talk to their vet for them. But again, it's not in my scope of practice to recommend nutritional supplements or anything for animals. So I have to be just very forthright that it works for my animals. And if you wish to try it, then, this is how it works.
Well, Barbie, that is definitely a blessing from God for your husband. It still blows my mind, everything that you've gone through and he's gone through as well. I don't have anything else. Doria, do you have any questions?
Well, I just had a comment. We know that animals, deal with the same type of health challenges that humans do, because, you can take your dog or whatever to the vet, and they write a prescription. It's usually, and if it's, whatever that might be, a infection in the bladder or something like that, they're usually giving them the same antibiotic that we would get as a human. But what I love about animals, there's no placebo effect. A lot of times when people take the redox, they think, oh, well, that's just a placebo. Well, animals, there's no placebo effect with them, so just a statement. But I just have a couple of things, just two questions. So I know you learned about, you said you use cold laser, but you use a lot of modalities in your chiropractor office. So how does, I know the redox is like another tool, but how is this set apart from what you currently use in your practice?
It is set apart because it works on the genetic pathways. And, the laser does work at the cellular level to repair cells at the mitochondria level also. So it's in a great adjunct to what we do with the redox. But the redox is going to replenish, of course, something in the body that we can't produce enough of as we get older and as we have injuries and as toxins get into our body. And so there is no substitute for that. I would say that's how it's different.
Okay. And then lastly, I know you probably, since you have had such awesome testimonies with us, how would you reach out? You're a chiropractor, and I know that Kathleen reached out to you just at like a vendor affair or something like that. How would you introduce this to other chiropractors? I mean, what would you say to them?
I have spoken to some other chiropractors on behalf of some ASEA associates, and the questions do come up. Do you just present this to everyone? Do you present this just as an all-needed basis? Well, we all know everyone needs it, even if you're healthy, because it can be working on cells that we don't even know need the assistance. And we may not feel anything, but it goes to work. But what I have learned is we have to get to know the people first and see what their needs are, see what their health is like. We can't throw too much on them at one time, even though I would like to, which is what I did when I first started ASEA. I told everybody and got everybody on it, and then people tried it 30 days and it didn't solve all their issues and they quit. So I realized I did a disservice. We have to get to know people, know their stories, know what their goals are. And some people will and some people won't, but shame on us if we don't offer it. And I use this with infants too, and have infant stories that are great. It's safe for all ages. So I have grown more bold, but I've also grown more respectful of when I present it to people, and just knowing when the right time is that people are open to something bigger and different. And it can always help their healing journey. But I say giving them information, like sometimes I'll just share links. And we sell at retail in our office so that people can walk out of here with their first bottle or their first tube of Renew. We don't sell all the supplements and stuff. I do some clay masks and things like that. But we educate them first now. We don't even if they want to take it, we don't let them until they have education. And until we've spoken with them, sit down, talk with them, talk to an upline with them, we don't let them get started because we don't want to waste their money and we want them to understand what they have.
All right. Thank
That's
you.
awesome.
Of course.
Does anyone have questions for Barbie, Dr. Barbie? Barbie, you're just going to reach so many people. That's amazing testimonies and the fact that you're using on people as well as animals. So if there's,
Great.
go ahead. Go
I
ahead. I'm
think
sorry.
Barbara Stoltz has a question.
Hi, Dr. Barbie. I just wanted to say we appreciate you sharing everything tonight. It was very touching. Thank you.
Thank you, Barbara. Thank you for being here.
And that's what we do. We keep it real, and sometimes real is a little wet. That's okay. I see
And I'm not a
Norm.
person that sees wet very often. I'm pretty hard nosed, so that was surprising that came out tonight.
That's okay. Norm, I think you're next, and then Betsy.
Hello, good evening, Dr. Barbie.
Good evening, Norm.
Hi, I was interviewed by these nice ladies a while back, several months ago, back when I think they were doing the March Madness. And I have some trouble with my veins where I get these wounds that reoccur on my foot, reoccurring for over 30 years now. And I heard you mention something about what you're doing for something happening on the foot. And I didn't quite get it. So I was trying to see what other modalities along with, I used the Renew 28 actually on it when they say not to. But I was able to close up something that was about 3/8 inch diameter in a month instead of 5 months.
Yeah, that's awesome.
But I'm also looking at the modalities that you use as a chiropractor that might help me to be able to close these things up so that I don't miss out on my kayaking because I'm scared to death to get in the water with one of these open wounds.
Sure.
We've had a lot of flooding up in New England where bacteria has gotten into the water and into the Long Island Sound. So I basically stayed out of the water.
That's a smart move.
Yeah. I don't want congestive heart failure again. Thank you.
Right.
Yeah.
That's a great question. I have used, it's called Erconia is the company that I use, and it's an Erconia cold laser. I've used them for well over, I'm going to say about 16 years, maybe longer in my business. And we actually do a lot of wound care with them also. I just now get to incorporate the Renew with that care. But the laser heals the cells from the inside out. And so when it seals over with a, it doesn't even really get a scab. It's just the tissue grows inward, outward. So once it's done, it's done. There's nothing left underneath. And I've used that technology with animals for years as well. But it's Erconia cold laser. They have a site called erconia.com, and they have a doctor search on that site also that you can see if anyone's near you.
How do you spell that?
ERCHONIA.com.
Thank you very much.
You're welcome.
I'm always looking at new ideas because, like I said, I've been dealing with these for 30 years. I use a silver impregnated foam bandage, and I also use a 2.5 pH water that kills MRSA in 30 seconds from my machine. That it's a Japanese machine where it makes that fantastic water. And then I have to neutralize that water after it does its kill in order to not heavily oxidize my wound. But that's what I've been doing to try to help get these things closing up quicker so I can get back into having fun.
Yeah, I will say it takes a little bit of time depending on the depth. I've got one homebound patient that I take care of right now in wound care. And we've been, I'm going to say close to 2 months, but he's finally down at a 0.4. And he's been battling these certain wounds that I kept telling his wife, please, 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 let's do cold laser and let's do the, redox molecules and stuff. But, they had their assignments of everything else. And finally, nothing else was working. And so we are really close to getting that healed up. And it was very large. So
Yep. My valves are all gone in my veins that are supposed to make the blood travel back to the heart. So I have to wear 30 to 40 compression to minimize getting these open sores. It's just been a very hard time for me. So the more I can learn about techniques that are being employed, especially in the chiropractic field, which I highly believe in, uh, so I can not have to suffer as much
Yes.
because
Well,
they're
good luck with
very
that.
painful, very, very painful.
I can imagine.
Yeah. Well, thank you for that information. I
You're welcome,
quickly
Norm.
heard
No
what you were
problem.
saying. Yeah.
No.
Thank you.
Uh-huh.
Okay, we have time for one more. Betsy? Betsy, you want to unmute? Is she still there?
I don't know. She was riding in the car, so I don't know.
Oh, Betsy? Okay.
Yeah.
I don't know. We may have lost her. Maybe she's driving. Well, Barbie, we want to thank you so much for that. That was such an awesome testimonial. And very touching. Like I said, I like it when people are real because, that really shows you how sincere and how serious this is and what this can do for you. And I appreciate that.
Thank
Betsy,
you.
if you happen to come back on, just let us know.
Yeah. I do want to say there is somebody from the Philippines that is on here.
I
So
saw that.
welcome. Yes.
Yeah.
I'm
Excellent.
excited.
Thank you all for coming. This has been amazing.
Thank you.
I think Barbie has pretty much put it in a nutshell about the passion of why she's sharing this technology, because of, a personal testimony related to her husband. And so we always tell people, if this is your first time seeing this evening, please get back to the person that invited you to come on, for Redox Nurse Talk. But if you see, you may know somebody that is dealing with a health challenge, or like myself, I didn't have a health challenge, but I knew it was something I wanted to do to be good for for wellness. And so if you know somebody that could benefit from this, please refer them to whoever invited you, or to one of us. The other thing is that if you feel like this has kind of resonated with you and you're dealing with some of these health challenges, then you could become what we call a preferred customer. And then if you're like Barbie and you're like Cindy and Norm and a lot of us that are on here, we just want to share this. It's our passion. As nurses, Cindy and I don't see the outcomes that even Barbie has shared this evening about, in our practices. Unfortunately, it's kind of heartbreaking because it's a conflict of interest. Cindy works for a company and I do too. And it's a conflict for interest for me to even share it with people that come in contact with both of us. But, it is a mission, to share this technology with as many people as we possibly can. Because of what we've seen, as you've heard this evening. So if you want to, join us, and I want to share, so Cindy and I are cross lines. We're not even on the same team, but we are on the same team because we want to share this with as many people as we can. And even I'm Barbie, so she's, because we believe in this so much, we come together to just having this Zoom and sharing this like we are tonight. So if you want to join us, we'd love to have you come alongside of us, to share it with more people. And then you're thinking like, this is not for me. That's okay too, because everybody has a choice, and we hope you do make the right one though. So thank you all for being, with us this evening. We're excited. Next week, we're going to have Marianne Sides. We've had her at the beginning of our year, but we kind of lost our recording. So we're bringing back those people that we weren't able to save the recordings. So Marianne Sides will be our guest next week. You can always go to Redox Nurse Talk on our YouTube channel, where you'll see the recordings, and all of them are uploaded. And I think we have 20 some up there right now, Cindy?
Possibly something like that.
Something
I've
like
lost
that.
track.
Yeah. So
Yeah.
anyway, that's all I have to say.
Okay. Did Betsy come back yet? They must have lost her. Well, everyone, have a good night, and we will see you back next Tuesday night, 7 o'clock Central.
Thanks, ladies. Have a good night.
Good
Thank
night.
you. God bless.